antimicrobial resistance as a part of our monthly Gen lecture series. First of all, as I said, I can see that many of you are joining us for the first time. Let's take 2 minutes to quickly run a poll and
वो
see.
मेरा भाई है, उनकी इज्जत करना, वो मेरी माँ।
Shikha ma'am, can you please mute yourself? I would request all of you to please keep yourself on mute. Towards the end, we'll have a Q&A session and then we can interact with each other. Yeah, so let's do a quick poll and see how many of you are joining us for the first time and how many of you are already a part of the network. We are launching a poll. You'll be able to see a few questions in front of you. Please answer those questions and then we can proceed forward. They are just multiple choice questions. We're trying to understand how many of you are here as network members and how many of you are joining us for the first time. And we'd also like to know what are the topics that you as an educator feel would be relevant for students on which we should organize subsequent sessions. So these suggestions would be really helpful for us. Okay, I can see that many of you have already answered. We'll just maybe wait a few more minutes for others to record their responses. Okay, as far as I can see right now, many of you, almost 70% are here for the first time. Your suggestions on topics would really help us streamline our further sessions. So please do respond to that question as well. Okay, so I think we can now share the results with you. Only 20% of you are members of the network, Gen Network, and rest everybody is new to the session. If I quickly look at what are the topics that have been suggested, climate change and mitigation, antibiotic resistance, environmental sustainability. Okay, we do actually have a lot of resources that we share in our monthly newsletter also. As part of the Gen network, you will receive a monthly newsletter from our site, which contains resources on all these topics that have been mentioned. So you can register yourself for the network and start receiving the newsletter. I'm sure it will be beneficial for your classroom as well. And we will also share a link to join the network for those of you who are new. Now, starting with today's session. So as you would have already seen in the announcement, we've mentioned it a couple of times. Today's session is something that's relevant. Today's session is something that's relevant for all of us. Antimicrobial resistance, or a situation where bacteria, fungi, all of these microorganisms develop resistance to antibiotics that were created specifically to destroy them. How does that affect our healthcare systems? What potential impact can it have on our lives? What are the causes? And more importantly, what can we do about it? So to talk about antimicrobial resistance today, we have with us CSE expert Rajeshwari. Welcome, Rajeshwari.
Thank you, Sakshi.
Yeah, let me quickly introduce her and then we can start with the session. So Rajeshwari Sinha leads the AMR program in CSE's Sustainable Food Systems team. She holds a doctoral degree in microbial biochemistry from IIT Delhi. She's also an alumna of Indian Institute of Management, Calcutta. And her work integrates science and policy aspects of AMR. She engages with global and national stakeholders to research, advocate, and push for necessary changes in policy and practice. So she is very well equipped to, help us understand the nuances of AMR. So without further delay, Rajeshwari, over to you.
Thank you. Thank you so much, Sakshi. And let me begin with, thanking all of you who have joined this session out of your interest. And although this is termed as environmentally speaking, this topic of unpacking antimicrobial resistance is not just environmentally relevant, but something possibly you will relate as well because it is relevant to our health as well. Let me quickly draw you to imagine. Suppose COVID, you are in the middle of COVID, and you get to know that this kind of a situation is caused not by a new virus like a COVID strain, but by a bacteria instead. And it's a similar situation that there is no medicine for it. It's not working. Whatever we have, whatever doctors are trying, it's not working. And at the same time, people are dying. The same kind of mayhem that we saw in COVID. Now, the only difference is the causative organism is, I am expecting you to imagine, is a bacteria instead of a virus. And as you start thinking about it, I will share the screen. And as I discuss today the issue of antimicrobial resistance and why this is something we all need to start thinking about and also do bits and pieces of changes at our own level. So this presentation is largely broadly divided into two aspects. One is where I will talk about what is this issue about, like Sakshi said, the basics, the impacts, the challenges, some numbers to give you the feel of why this is important. And the second part of the presentation will be about, as CSC, what we do through the AMR and antibiotics program that I have been associated with for almost a decade in this organization now. So, moving to the first part, understanding antimicrobial resistance. I'm sure you may have heard about it, or you may have come to know about it because now there is a lot of awareness on this issue. But to begin, I thought this is the best way to start using CAC's down to earth initiative's own cartoon to talk about this issue. Here you see that there is a big bacteria which has become superbug, and it is saying that I have become a superbug because of antibiotics. So, but why? Antibiotics are supposed to kill bugs, but this bug has become super because or a superbug because the antibiotic has not been able to kill it. And possibly that's what is antibiotic resistance. And if I make it a bit broader, if I say antimicrobial resistance, it's about how Sakshi introduced, is that the medicines or the drugs which are used to kill microorganisms, infection causing bugs like bacteria, virus, fungi, or parasites are not working because these microorganisms have become resistant to it. When it is specifically about an antibiotic and a bacteria, we call it antibiotic resistance. And this picture, which I have picked up from the CDC, it basically gives you a sense that how this proliferates. For example, there is an infection or there is a pool of bacteria which has both drug resistant bacteria and normal or good bacteria. And when you expose them to antibiotics, the good bacteria, because they are susceptible, will die or will be killed, and the resistant ones will be able to thrive and continue to populate and multiply, ultimately having or giving us a larger population of bacteria which is only and only drug resistant. So what will happen is when we are administering antibiotic, this bug is not going to work against, this drug is not going to work against the bacteria, and the infection will be difficult to treat. So it's the concept of survival of the fittest. We must also understand that antimicrobial resistance is nothing which is. If I may request you to kindly mute yourselves, it will be great. But how does AMR happen? This is a natural phenomenon. It is the tendency of every bacteria. It's a defense mechanism which they usually adopt to counter to any kind of foreign presence by becoming resistant, by becoming defensive. But why does this become a problem? It becomes a problem when we start misusing and overusing antibiotics. That's what this picture is saying. That if you are using it at a regulated or a recommended level, you are able to tackle the bacteria. Once you start overusing it, the bacteria overpowers because it is now tackling you. What happens is because of overuse, we start there is a greater selection pressure on the bacteria, because of which the population of resistant bacteria continues to multiply. And there is also a genetic angle to it, where the transfer of resistance causing mechanisms can happen at the genetic level. I will not go into details, but just to let you know that there is a genetic angle to it as well. Okay, moving to the next slide. The scale and impact of this problem is huge. Why? Because, like I said, it's multiple microorganisms. Within bacteria, there are different kinds of bacteria, gram-positive, gram-negative. The infections can be multiple organ systems, or it could be multiple body tissues. It could be gut infection, blood infection, multiple infections in the human body, different sources of infection. It's a community-acquired or a foodborne or a hospital-acquired infection. It can impact the outcomes of not just infectious diseases, but also non-communicable diseases like cancer or diabetes, which are basically chronic diseases. But because of them, your immunity comes down to certain levels. It is so low that you are attracting secondary infections. It can also impact post-surgical infections. Then there are concerns around a bacteria becoming resistant to multiple drugs, or a bacteria becoming resistant to all drugs, which is pan drug or pan antibiotic resistance. So the scale of this problem is big, and there are some projections which say that if we don't tackle antimicrobial resistance now, it is estimated that 10 million lives per year will be at risk by the time we reach 2050, which is just in about 15 years from now. And about 90% of this impact will be seen in low and middle income countries in Asia and Africa, and 2 million of which could be in India. So this is a projection which had come out in 2016. I also want to let you know that this impact of this public health concern is not just limited to human health, like I have been saying. It will impact livelihood, economy, and development, as well as it's going to impact the food animal production as well as the environment. To put some numbers to what I have been saying, there was a recent Lancet publication which said that in 2019, about 1.3 million deaths were attributed to the issue of AMR, and a larger span of 5 million deaths were associated with AMR. And to give you a contrast, commonly known, commonly heard diseases like HIV and AIDS in 2019 killed about 0.86 million, and malaria killed about 0.64 million in the same year. So you can see the extent and the number of times that AMR is causing an impact. But the problem is that AMR is invisible, AMR is silent. We don't see AMR. We don't get to prescribe, doctors cannot prescribe that this is a disease. It's a phenomenon that keeps happening. When it comes to livelihood, economy, and development, again, a World Bank projection says that in a high impact scenario, a GDP worth 3.8%, a global annual GDP can be lost. The livestock production can be impacted with an 11% loss. By 2030, it could push about 24 million people to extreme poverty, particularly again in developing countries. And not just this, it could even impact the achievement of sustainable development goals by 2030. Now, like I said, there are multiple drivers of AMR. It's not just humans which are misusing or overusing antibiotics. This use and misuse of antibiotics or overuse of antibiotics issue is there also in the food animal system as well as in the crop production systems. Antibiotics are used in poultry, fisheries, dairy sector, swine sector for increasing animal growth, for keeping away diseases so that the production is not affected, even in crops. And at the same time, there's an environmental and a waste angle to it. If we don't manage waste, most of the antibiotics that we consume, 70% of it is excreted out, which is unmetabolized. So all of it is going out as part of the waste. And through the waste, we are allowing antibiotic resistance causing determinants to go into the larger environment. And it is the environment which we access again, like in the case of drinking water, for example, surface water, the community uses this kind of resources for its day-to-day daily activities. So the AMR is largely a One Health concern, by which I mean that there are multiple factors contributing to this issue. But why should you be worried? Why should you go back today and start thinking about addressing AMR? It is because we are in the middle of a triple crisis of AMR. Like I said, antibiotics are becoming ineffective. critically important antibiotics are those which, according to the WHO, are very relevant for human health and needs to be conserved for human health. We are losing them. Their effectiveness is going down. And then because their effectiveness is going down, we are having to resort to more expensive antibiotics, more expensive medical treatments, longer hospital stays. Ultimately, our treatment options are reducing. But it's not just about antibiotics becoming ineffective. We don't have new antibiotics at the other end. That's the other crisis. Over the last 4 decades and even more, there has been no new antibiotics in the market, particularly against gram-negative bacteria, which are said to be more notorious, which are said to be more sturdy and more robust and very difficult to handle. This is despite the fact that there is so much need for new antibiotics, and resistance to existing antibiotics is growing. And the third crisis is the issue of access. Even if today we have new antibiotics, even if today we have effective antibiotics, several parts of the world, several developing countries are those which are not able to access these antibiotics. And there could be many reasons to it. There could be regulatory reasons, there could be cost of antibiotics, there could be supply of antibiotic reasons. For example, countries in Africa, many countries in Africa do not have access to antibiotics to even basic diseases, basic infections. So we are battling this triple crisis of AMR, and it's very important that we start thinking at our own levels what we can do. But there is traction, there is a global momentum to this issue, and a lot of global agencies and countries are coming forward to tackle this issue. This momentum at a broader level is being handled, is being fought by the quadripartite of the WHO, which is the World Health Organization, the Food and Agriculture Organization, the FAO, the World Organization for Animal Health, and the United Nations Environment Program. So if you look at it carefully, it's the Human Health Agency, WHO, the Agriculture Agency, FAO, the Animal Agency, WOA, and the Environment Agency. Again, one health factor coming and all working together. This is also being led by the Global Leaders Group on AMR. I have highlighted it because our Director General, Sunita ji, is a member of this Global Leaders Group on AMR, which works at a very high governance level to look at how globally we can address this issue through changes in policy and practice. Other than this, AMR is a very important topic of discussion in United Nations General Assembly, in the World Health Assembly, in G7 and G20 discussions. Countries have national action plans, and not just national action plans. In India, we even have state action plans to tackle this issue. And then we have civil society, industry, student community, scientific community, educators community, all stakeholders coming together to fight this issue. This is just to give you a broad sense that this issue is something which is being handled seriously and being talked about at a policy level. This was the first part of my presentation. I also now want to apprise you about our journey on AMR over the last decade and a half, and what are the areas through research, through advocacy, through our awareness and capacity building efforts and lab studies, what are the particular body of work that we have built, and how we think, what kind of solutions we have. But I must also mention here that we have largely focused on the animal and the environmental components of AMR, like I had showed in that One Health slide. And also our focus has been to look for solutions, to talk about solutions which can work for developing countries and not for solutions which can work in the Western world, because we are ultimately a developing country and we need solutions which work for us. So my first point is we have done some work on understanding the access to effective antibiotics and the antibiotic research and development crisis. And again, I found a very interesting cartoon again from Down to Earth, which says that this doctor is saying that, our new line of antibiotics is getting a very positive response. And when the colleague says, is it from the patient? So the doctor says, no, it's from the microbe. So the patient is not responding to the antibiotic. Instead, the microbes are becoming stronger and handling the antibiotic. So this is, which says that this is something to worry. To let you know that when I was saying we don't have new antibiotics, this is a slide which will explain you why I was saying it. The future antibiotic pipeline is, weak and lacks promise. Now, why? It is because if you have understood, or if you know the development pipeline, there is a preclinical stage, there is a clinical stage, and then there is a registration and market. That's how molecules move in the research. So right now in the clinical stage, which means that it will go into there is a possibility that these molecules have possibility to go into the market. There are only 77 molecules of possible antibiotics, of which 45 are traditional chemical antibiotic molecules, and out of which 28 are those which, according to the WHO, are specific to certain pathogens which they think is very important to be handled at an urgent basis because they have become resistant and are infection causing. But when I look at other disease areas, if I look at cancer, if I look at neuropsychiatric diseases, immune disorders, on the right, you will see that we have more than 10,000 medicines in clinical development for cancer. Look at the comparison, 77 molecules in clinical for antibiotics and more than 10,000 drugs in development for clinical development for cancer, more than 1,800 for neuropsychiatric conditions, and about 1,500 for endocrine, blood, and immune disorders. But why is this so? It is because the companies, the pharma manufacturing companies today are not interested in antibiotic development. Why? They attribute it to a reason called market failure. So what they say is, we don't make money out of it. The reason is an antibiotic is needed to treat an infection. The doctor will give you a course for 3 to 5 days. That's the longevity for which you will need an antibiotic. On the contrast, if a person has a chronic disease like a cancer or a diabetic, the drugs are much more expensive and they will be needed for a much longer time. So when we did a very quick assessment of 15 major pharmaceutical companies to see, where is their focus of work? What are the molecules in clinical pipeline? So out of 1,007 molecules in the clinical pipeline of these 15 companies, I have not named them, but just to let you know, only 13 were antibiotics or antibacterial candidates, which is very alarming. And in contrast to this 13, there were 400 candidates for cancer, around 411 for cancer, 150 for immunology, 84 for cardiology, metabolism, and other related areas. Now, this is worrisome. But what we also feel is that this big exodus that pharmaceutical companies are doing is not just because antibiotics is not making money, it is also because we have more profits in other disease areas like cancer, diabetes, and areas which I mentioned. The other part of our work has also been on the sustainable food production systems. This has been the larger chunk of our work, as I said earlier. And it may be new information to a lot of you, but yes, antibiotics are used in food animal production systems also. It could be the chicken meat that you will be eating or you have eaten last night. It could be the milk that our family members are drinking or the fish that we eat. And it is because that today food animals are being produced in intensive systems because of the larger demand and the larger commercial interest. We need quicker growth, we need quicker output, we need quicker products. What do we mean by intensive systems? As you saw in this picture, and if I can put some words to it. So when we say intensive systems, it means that you are rearing a large number of animals together in a very high stocking density. You have just clubbed them together, genetically selected similar breeds and have kept them in confined conditions in close proximity to each other. Now, what will happen if you keep them in close proximity to each other? Not only there will be high stress, there will also be generation of diseases, transfer of disease causing bacteria or virus, and disease. And eventually that will also need disease handling and need for antibiotics going forward. But other characteristics also include dependence on commercial feed. You are more reliable on needing commercial inputs, chemicals. It is often vertically integrated by players, which mean that there is one player X who has managed everything: the animal farm, the feed, the production, the product, the supply. The company manages everything, and these industrial systems are usually pitched as being agriculture, so they often bypass any kind of regulatory focus or attention. But like I said, what has these kind of systems led to? It has led to the use or misuse of antibiotics, not just for therapeutic, for disease treatment purposes, but also for non-therapeutic purposes, which I just said. You need to make the chicken fatter and heavier. Otherwise, the farmer, if he sells the chicken, he will not get much price. In a way, it is linked to the livelihood of the farmer as well. So what the farmer will do, based on the guidance by the contract player who has hired the farmer to rear chickens, he or she will administer antibiotics through the feed or through the water supply. That is the growth promotion. The other angle is the farmer may be scared of losing the bird, or the bird dying because of a small disease. So he will administer antibiotics as a preventive measure to all the birds. Imagine 9,000 poultry birds in a farm and all given antibiotics at one go through water, because it is a preventive measure so that the bird does not fall ill. What is also interesting is, I want to draw your attention to this Venn diagram, is that across the three areas, critically important antimicrobials are being used, which I again said are pertinent for human health, but here we see their widespread use in food animal production, for growth promotion, for disease treatment, as well as for treatment of the disease. Now, I also want to quickly stop here for a minute and say that while intensive food production systems lead to disease and it leads to antibiotic use, the other is also true. Once we start using antibiotics, we will see that our birds or our animals are not falling ill. So they become a quick and easy substitute for good farm management. So in that way, you don't need to manage the farm, you don't need to keep the farm clean, or you don't need to give a lot of effort in farm biosecurity or farm cleanliness. You just give antibiotics as a preventive measure so that the disease does not happen. So both are true, and eventually they are all linked going forward, not just to antimicrobial resistance, but also climate change, zoonosis, and pandemics going forward. Just to give a snapshot of our body of work on AMR in food systems, we have over the last couple of years, we have looked at our work in antibiotics in honey, antibiotics in the poultry sector, antibiotic use in the aquaculture sector, antibiotic use in the dairy sector. So we have seen and we have reported the practice. You can find all this information on our CSE website. We have also seen what the fast food industry is doing when it comes to sourcing chicken for its products. How concerned is it about the issue of AMR? We have looked at antibiotic use in crops. We have looked at antibiotic use in animal feed. We also did a very interesting report on what is the extent of antibiotics that are being used in Indian food animal production sector. And based on our body of work, some of the big gaps that we see in the food, animal, and crop sector is that we don't have any data on what antibiotics and how much antibiotics are being used in food animals. There is no formal data in public domain which we can use to interpret and inform or take some actions. At the same time, like I said, antibiotics are being used for growth promotion and disease prevention in food animals. But why? Because there is no definite law to restrict it. And even if we have laws, implementation of those laws on the ground, looking at other challenges on the ground is always a concern. There are no laws around critically important antibiotics, particularly in India, on what should be allowed for use in food animals or not. Colistin is a last resort antibiotic in hospitals, which means that when nothing is working, give colistin to the patient. The government of India, the Ministry of Health, has banned colistin from any kind of use in food animal production. But still, although colistin is banned, there are several other antibiotics which we have seen are being used in the food sector in India. Another issue is there are no treatment guidelines. And in humans, there is a treatment guideline. Doctors are made wary or aware of their treatment guideline. For example, if there is X disease, then you can give this antibiotic. But for animals, we don't yet have a national standard treatment guideline. So what happens is anybody can recommend any antibiotic, which is again leading to this kind of misuse and overuse. And there is no dosage, there is no quantity, there is no specifics around for what disease, what antibiotic you can use in the food animal sector. Similarly, there are no data on what kind of or what levels of antibiotic residues are there in food, in chicken, in milk. There is a milk survey by the Food Safety Standards Authority of India, but other than that, there are no formal public data on public domain. And at the same time, there is also limited information or no information for that matter on how we can manage waste from the angle, from the lens of AMR. There's a lot of work on how to manage farm waste policy work, but not from the lens of AMR. But I just want to, also bring to you some hope.
Yeah, we just have about 10-12 minutes. So if we could wind up in that time.
Okay, I'll do it very quickly. Some bit of hope. There is also alternative to antibiotics in the Indian dairy sector. There is a project of the National Dairy Development Board, which is using ethno-veterinary medicines to treat mastitis in dairy cattle. And this is something which is using aloe vera, turmeric, lime, and mustard oil, which can be made at home. And farmers are using it on their cattle, and they have seen brilliant results. When we analyzed data from NDDB, what we saw is that out of 7.8 lakh cases, there was an overall cure rate of 80.4%, which means 4 out of every 5 animals they were able to cure using this alternative to antibiotic of ethno-veterinary medicines. And what do these results mean? When you look at the graph, you can clearly see that it has brought down the cost that has gone into buying antibiotics, cost that has gone into visiting veterinarians. Not just it is a reduction in overall treatment expenses, it has also led to safer milk products and improved livelihood of farmers. The third part of the work is the management of environmental spread. I have explained this earlier, how different point sources from farms, factories, from our own houses, from healthcare settings, all the waste containing residual antibiotics, antibiotic resistant bacteria, or even genes are going into the larger environment. So this issue is complex and cross-cutting. And CSC has also done some bit of work. A larger part of its work has been on the pharmaceutical side, because antibiotic pollution on pharmaceutical waste, pharmaceutical manufacturing is getting a lot of traction in the global discussions. We have also looked at how AMR spreads in the poultry environment, and how AMR spreads because at the household level we discard them without any kind of treatment or any kind of measure. I will very briefly touch upon this. Where do we stand today? Where we stand is there is awareness about the issue, but there are big challenges when it comes to handling this issue at our level, when it comes to capacity and resources. Environmental regulators in India are more trained about pesticides and other kind of chemicals and less about microbiological issues like AMR. There's limited global guidance, and also cost-effective measures of managing waste is not there. The last part of our work has been on implementing national action plans effectively. At CSE, we have worked not just within India, but also globally with several low and middle income countries to help them develop and implement and support them with inputs, LMIC perspectives on how AMR can be managed, focusing on the animal and the environmental dimensions. On the right, you will see that we have worked very closely with Zambia, working on some key policy documents, and also on a larger overarching issue of containing AMR. CSE has also been involved at the national level, working with the government of India to develop national action plans, state action plans. It has worked with Kerala, Madhya Pradesh, and also Delhi to develop state action plan. And it has also worked with Pan India at state level to tell them how One Health action is needed to prevent and control AMR. I have already touched upon these slides, but so far some of the key actions has been the Ministry of Health has been able to ban colistin. There is a ban on the use of antibiotics in crops. There is some work happening at the level of environmental guidelines for management of poultry and dairy sector waste, and the Foods FSSAI has come up with standards for antibiotic residues in food from animals. This is my second last slide probably. So we need solutions. But like I said, we can't have solutions which is very global. We need solutions which is cost effective, which is technically less demanding, and which is relevant to local context. So the best solution is to focus on prevention. Let's all focus on prevention at farms, prevention at factories, prevention at household, prevention in healthcare settings. At farms, this means less disease. Once we have less disease, it is less antibiotic use, and going forward, less AMR. And this can be done with clean water sanitation, good alternatives, like I said, good kind of farming practices. In case of antibiotic manufacturing, if we are able to invest in good process controls, if we are able to invest in good waste management technologies, then probably the AMR issue can be much better handled at the environmental level. At your own household level, you handle COVID just by separation and keeping distance and by washing hands. So the same thing can work for AMR. It is again a preventive measure. And at the same time, we need to make our animal farm waste AMR safe. Reuse of animal waste in India is a very big source of livelihood and economy for the large farmer base that we have in India. So it is very important that for us, making the waste AMR safe is very important when it comes to talking about the organic farming movement. Last slide, One Health approach is very critical. This is an issue which needs One Health effort. This is a time where we cannot say that human health is consuming more antibiotics or there is more antibiotic consumption. But we definitely need to rethink the way we are using antibiotics. We need to rethink the way we produce our food and how we manage our waste. Because it is not just linked to our own health, it is linked to the health of the environment, it is linked to the health of the animals, and it is also linked to the development, commerce, and trade. Eventually, if you are able to manage AMR through a One Health response, there will be co-benefits related to limiting pandemics, zoonosis, various diseases, climate resilience, livelihood. So I'd like to end with that, Suganya. Sakshi, I'd like to end there, and maybe we can take some questions, if that's okay.
Yes, yeah. Thank you, Rajeshwari. You really did break down the issue for us quite comprehensively. We do have a few questions in the chat box. Dr. Janvi, would you like to unmute and ask your question, please? Are you here, Janvi ma'am? Okay. We had another question from Veena ma'am. Are you here, Veena ma'am? Okay. So let me read out the question. Maybe you can answer it for us. Veena ma'am's question was about multi-drug resistant organisms. Can they spread from one patient to another, and how?
Okay, just to answer this question, multi-drug resistance is the property of the bacteria, right? This bacteria is able to resist multiple drugs. When it comes to spreading from one patient to another, I think it can definitely happen. For example, as simple as sneezing, as simple as coughing, and it's a bacterial infection, or it's a sputum issue, or it's in a way, and you are doing handshake, and you are in that case you are transferring the microorganism from one person to another. So just related to COVID, in COVID it was said that just stay away from each other because you don't know how you will transfer it. We are not able to see the bacteria, but the property of the bacteria is such that it is there, we can't ignore it. I can't say that I am sitting in this room and there is no bacteria. It's there. So it can spread from one person to another.
Okay, we have another question from Abhishek Bhomik. Can you please unmute yourself and ask your question?
Yes, good afternoon, madam. Good afternoon, everyone. Good afternoon, the honorable speaker. Your session was really indeed a fantastic one. My particular area of work is on anthropological basis of biodiversity conservation, environment, climate resilience, and also the issues of antimicrobial respect, which is a part of the thing which I concluded from your session, is definitely a informing and relevant part to that. So what my question is that zoonosis, reverse anthroponosis or anthroponosis, that means reverse anthroponosis from human induced diseases transmitting to any other organism, particularly the mammalian sector or any other kind of phylum of the animal kingdom. That's the case of reverse zoonosis. So the thing is like that. So what I intend to ask is that regarding these issues, how far the concerning issue of antimicrobial resistance can be a part, and my second question is, what are the concerning steps that the government are implementing in case of India and respective industries to prevent this antimicrobial resistance? Right now you said about cases where the laws concerning the animal issues or the surveillance of the usage of antibiotics and any other feed or any other implementive things, the protocols, the things that are being incorporated in these industries, they are not up to the mark of the standards of the international basis. So what the policies are needed to be done in the Indian framework?
Okay, thank you, Abhishek. My response to your first question is reverse zoonosis is definitely something which we cannot ignore. It is there. When we talk in the language of AMR, so far the larger discussions in the policy space, the larger discussion that we see has largely been about zoonosis as to how it is transferring from from animals to humans. But it is also true that the issue of reverse zoonosis happens in parallel and cannot be ignored. And if there is an infection in the animal because of transfer of a disease causing microorganism from human to the animal, it is again something which will need attention, not just from the point of antibiotic use, but also from the point of AMR and other related concerns. So I hope I'm able to
Yes,
put in
madam.
context what you were asking.
Yes,
The
yes,
second
madam.
part is how government is working. What I said is not that I did not mean that it's not up to the mark. What I meant is we need different solutions. We
Exactly.
cannot have policies similar to West because we are not the West, because our situations, our climate, uh, our ability to tackle things, our resilience towards things are very different. Now, having said that, the government is, of course, cognizant of all of what I am saying and taking measures. For example, it is working on developing a law around regulating feed for poultry. It is working on developing, just 2 days back, there was a discussion on developing a poultry action plan through a One Health spectrum. I'm sure there was discussion on how AMR will be a part of it and how poultry can be managed so that disease is less and antibiotic use is less. The government is also working on developing the second version of National Action Plan for antibiotic resistance. So the government is definitely, if I may use the word, very much aware and very much aggressively working on addressing this issue, but keeping in mind our local context, our needs, and our priorities. That's what I have to say.
Madam, one thing, I am a user of the Down to Earth magazine, which is there in your concern. So, and you told, rather, you said about those particular, you displayed also the magazines where the context of antimicrobial resistance and the overuse of drug usage is also given over there. So, in any case, if I do have any questions regarding my dissertation or area of work, can I feel free to be in touch with you people? As I have taken down the email IDs of the respective concerned persons to be in touch with, also yours as well. So will it be feasible enough that I be in touch with you regarding some information that I can have from your side?
Yes, absolutely. I think, Sakshi, I'm taking the liberty to respond.
Yeah.
I don't think there should be a problem, but also to add to this information is all our work is on public domain on
Yes.
AMR, and you can access everything that we do on AMR particularly. It's there in the CAC website, and you can also reach out to us.
Yeah, we'll
Thank you,
also
ma'am.
upload Rajeshwari's PPT on the website and we'll be sharing the link with you. We'll also share the recording of this session in case you
Yes,
missed
madam.
out on any parts. So we'll do that. Okay, moving on to the next question. Udit, can you please unmute yourself and ask your question if you're here? Okay. Rekha Bhatti, do you have a question? Okay. Okay, anybody who has a question now can unmute yourself and directly ask your question to Rajeshwari.
हेलो
Hello, yes, Rekha ma'am.
तो मेरा क्वेश्चन ये था कि हाउ वेस्ट मैनेजमेंट हाउ कैन वी सॉल्व दिस प्रॉब्लम
Okay, so namaste Rekha ji. To answer your question, जैसे मैंने कहा, waste is something which is again contributed by multiple sources. तो एक तो हो गया farm waste. फार्म वेस्ट का सोल्यूशन है कि आप फार्म में सबसे पहले तो एंटीबायोटिक यूज less antibiotic to the extent possible so that the extent of antibiotics going out from the farm as waste is again reduced. And in order to use less antibiotic, you need to opt for good farm management measures so that there is less disease and less need for doctors and antibiotics. Then there is another angle of waste which is coming from manufacturing or any kind of factory, for example, a poultry processing plant, a fish processing plant, or a slaughterhouse, all of these will have antibiotic residues or antibiotic causing resistance causing genes or antibiotic resistant bacteria. Even there, I think the issue should be about having proper technologies or proper measures so that you are able to quantify the levels of these kind of determinants and then tackle them in a way that into the larger waste these determinants do not go. But I must also mention that it's not easy to say that you have technologies and you suddenly start using this technology. We have to also invest in having the right kind of technologies which is low cost and affordable. When it comes to pharmaceutical manufacturing, like I mentioned, again, process control measures within the process of antibiotic manufacturing, invest in measures so that there is less and less loss of antibiotics going into the waste, into the pharmaceutical manufacturing effluent. When it comes to human health, if you ask me what do I do about the waste, then there is the sewage which is coming out of human waste. It is going into the CTPs and the STPs. There has to be proper mechanisms on how these STPs are able to manage, particularly antibiotics and resistant bacteria from the sewage. Take them away from the sewage before they are discarded into the larger environment. Similarly with CTPs. But I think the global answer and the easy answer is why not adopt prevention as an approach as humans, as farmers, or as manufacturers. Once we adopt this strategy, I think a lot of the problem going forward will be solved. You will not need to invest in these kind of technologies, high end assessment, high end surveillance, high end measures. Invest Prevention does not need any money. Prevention will be something which you will do at your own level. I will prevent myself from falling sick so that I don't have to use antibiotics unnecessarily. I can see a chat here which has said that I have been prescribed antibiotics for 15 days for some infection which the doctor was not able to identify. So all these kind of measures we can adopt so that we are able to avoid these kind of situations.
Okay, thank you, ma'am.
Okay, we can take probably one or two more questions. Anybody would like to ask a question?
Hello, I am Dr. Anish Bhattacharya. I am working with antibiotic resistance in microbial ecology and evolutionary perspective for almost 10 years now. I was just wondering if you guys have any chance of collaborating with different people who are in science and academic institutions, and can you collaborate with us who are working with these kind of stuffs, because you have the resource to go in the field, but in
Sir,
our case.
I think this would be something that is better taken up over email if you wish. So
Yeah,
you can
sure.
probably write to the team and then they can
Yeah.
get in touch with you.
Okay,
Anybody?
thank you very much.
Yeah, thank you, sir. Anybody else who'd like to ask anything pertaining to the session today? Yeah, Krishna Kumar sir, do you have any questions?
No.
Okay. There's a question in the chat, Rajeshwari, regarding government action plan against plant pathogen resistance. It's probably very unclear, but if you could.
Yes, I think, Sakshi, as much as I can make out of the question, my response would be see, plant pathogen resistance, particularly in the context of antibiotics and AMR, is right now at a very research level. When it comes to plants, the larger discussion that is at least there in the government and policy space is how to reduce antibiotic use in plants. And there has been a policy development where the government was able to ban the Ministry of Agriculture was able to ban the use of streptomycin and tetracycline. This was earlier used as a fungicide in the crop sector, which has been banned starting January 2024. And again, this ban is subject to the availability of alternatives. So we don't know what is the current status, whether we have been able to find out alternatives or not. When it comes to government action plan, It is definitely a concern. People are talking about managing antibiotic use in crops and reducing antibiotic use in crops, but I'm not sure whether how far we have moved on plant pathogen resistance. I really do not have much information on it.
Okay. Just probably one last question, if anybody would like to ask. And yes, Abhishek sir, we will be sharing
Hello. I need to ask a question.
yes,
As you
Shailendra,
said,
go ahead.
as you said that the reason for most of the antibiotic resistance is the misuse and the abuse of the antibiotics. And the major problem is that the antibiotics are available OTC in our country. So I think a tight regulation over the use of antibiotics and the sale of antibiotics through OTC is required, which can be made by the government, not by self.
Yes, sir. You are right. But I just have to say that to add to your point is, the policy, the law, everything is in place. Implementation, I will not say is a concern. Given the large landscape of India, the number of population and the number of regulators that we have working on the ground,
That
there
is
are
why it is very
limitations.
difficult. It is very difficult to regulate this all in our country because the status of our country is so that where we cannot regulate many things. And
Yes.
in fact, even we cannot stop the availability of the medicines over the counter. So I think it is very challenging to curb the development of the antibiotic resistance. So I think some alternative strategy and understanding about the use of antibiotics and its recommendation that is much required. So what is your say? Means as a researcher, I don't think that we have anything to do. We can only do the estimations, evaluations of the microorganisms which are developing the antibiotic resistance. But
Yes.
Solution is not in our hands.
Yes, sir. Just to add to your, whatever the issue that you're raising, the answer I would say is, there is no overnight solution to the issue of antibiotic resistance. This is something which is eventually antibiotics will any antibiotic that we have going forward over X, Y, Z years, the bacteria will start becoming resistant.
In fact,
But you will.
the resistance develops in the nature as well. In the area where there is no exposure of the antibiotic.
Yes,
because,
that's the power of the environmental dissemination. But at the same time, you will also note that there are some older antibiotics which are now working. The reason is because those older antibiotics, which we have stopped using for so many years, are now starting to show some activity again. So there it is in our prerogative how we pick and choose solutions and what measures we take instead of losing hope and believing that there is no solution. The solution is
some alternative medicinal
yes.
therapies can be used
Yes.
like the herbal applications and
Yeah, I mean, we have not studied alternatives from the point of view of human health, but I would definitely agree to you that alternatives can be a good solution because we have done this study particularly with NDDB to see that how it is working in dairy sector.
Okay,
Right.
I think
I have
I would have
one
to,
more.
Shailendra sir, could we take this up maybe over email later on?
That is fine, email. Otherwise, you can just make a group on which we can have the discussions on.
Yeah, sir. So, okay, I can see a lot of messages complimenting your presentation, Rajeshwari. So, it really was a great session. Thank you so much. And I would like to once again reiterate that we do such sessions every month. So, if you are interested in joining further sessions, please do register for the network. You'll start receiving updates. Is somebody saying something? Their mic is on. Okay. Thank you so much for joining us today. Thank you, Rajeshwari. We'll be sharing the recording as well as the presentation that was used today with you over email. Thank you. See you next month. Thank you, everybody. Good evening. Thank you, Rajeshwari.
Thank you, Sakshi. Thank you, everyone. Thank you. Bye.
Bye-bye.